Hi, this is Dr. Eckhart with the Women's Therapeutic Institute. Today we're giving you an overview of progesterone usage for our product Progesterone, and we're at Women's Therapeutic Institute. So let's first go over how you would use topical progesterone, either cream or oil. I would use either 20 to 60 milligrams a day. For our product Progesterone, that's 1 to 3 dropperfuls a day. One dropperful is just an eyedropper, and you suck up about 2 inches of oil, and that's equal to 0.14 teaspoons. One bottle lasts anywhere from 2 weeks if you're taking 60 milligrams a day to 2 months if you're taking 20 milligrams per day, only 2 weeks out of the month. One bottle has 40 dropperfuls. Make sure to rotate areas. So one day you would use your, let's say, your left arm, and the other day you'd put it on your stomach, and just keep rotating it every day. And the reason why is the subcutaneous fat will saturate if you keep on doing left arm, left arm, left arm. Once again, I'd like to emphasize that the topical skin dose of anything is 10 times more potent than if you were to eat it. So if you eat it, whatever you eat is 90% pre-filtered by the liver. Anything taken rectally or vaginally is also pre-filtered by the liver, because that area of the body is drained by the portal vein, for you students of anatomy, and the portal vein goes straight to the liver, and whatever is put there in rectally or vaginally is also 90% pre-filtered by the liver, so you only get 10%. However, anything that you put on the skin or on the outside of the body is not pre-filtered by the liver, and therefore is 10 times more potent, so it bypasses the liver. So therefore, anything that you put on the skin has about 10 times more importance to you than what you eat or take in vaginally or rectally. Unfortunately, I love the health food store. I used to, I still take organic food from the health food store. I love them, okay? But unfortunately, many of the herbs and chemicals from the department store or the health food store on your skin is making you sick. And the reason why it's making you sick is because these chemicals are hormone disruptive and also mimic estrogen. One prominent herb that mimics estrogen is lavender. Okay, and these things make man boobs. They create gynecomastia. And if you look at the following lectures, I will present evidence on that. Also, parabens are used as a common preservative. They're quite safe from a carcinogenic point of view or from a toxic point of view, but you can see that there's this benzene ring in it, and this benzene ring fits into the estrogen receptor. So even though most cosmetics and toiletries, natural and organic from the health food store, are hormone disruptive, and again, lavender creates man boobs. If you have a very severe condition, you have to be extremely careful what you put on the skin. So here you have a contrast between mild and severe disease. For a mild disease, you don't have to be so careful, but I would use the products on the purple sheet. Do not use any other things that are not on the purple sheet. With severe disease, you have to be extremely careful what you put on the skin. Use the yellow sheet. And again, I've had patients complain of mascara, shampoo, and especially laundry detergent, deodorants that make them sick, increase bloating and breast tenderness, and increase their sickness. So please do not deviate from the purple sheet. It is extremely unlikely that you'll find things that work, but it's possible. But the purple sheet was made by, I went through all those things for several weeks, and patients will suggest different products to use over the years. It's extremely unlikely that you'll find things that work, but possible. But please do not deviate from the purple sheet. I looked through 500 shampoos. I found 3 of them only. My goal for you is to be totally normal and not take anything at all. Okay, and here's the dirty little secret. If you're really good about your avoidance list, you won't need progesterone in 2 to 9 months. Okay, do not deviate from the purple sheet. Please do not use anything different from what's on the purple sheet. When you're well, then you can experiment with different things. But typically, people find things and from the health food store they think are safe, they use them, and they get sick. Now, so the question is, well, why take progesterone? Well, progesterone can only balance out small amounts of xenoestrogen. So if you have progesterone, okay, it can only balance out small amounts of xenoestrogen. So some people like to cheat, drink coffee, and take progesterone. That's fine. But again, if you're really good about following your avoidance list, pretty soon you won't even need progesterone. Now, but progesterone cannot balance out large amounts of xenoestrogens. So if you have progesterone and you have a large xenoestrogen load, it's not going to work. In fact, 40% of patients that don't cut out xenoestrogens will get temporary worse until you stop the progesterone. Or, if you do not cut out xenoestrogens, progesterone works for the first couple of months and then does not. So if you have a large xenoestrogen load, it's not going to work. Your symptoms will actually get worse temporarily. So in 40% of patients, large xenoestrogen loads make them downregulate their estrogen receptors. So it makes these estrogen receptors less sensitive to estrogen. Progesterone wakes up these estrogen receptors, okay? And then your original sensitivity to estrogen is restored. It seems like you're getting more estrogen, but you are really not. So that's why if you go to the progesterone forums, some people say, progesterone, this is the best thing since sliced bread. It's great. I feel so much better. Other people will use progesterone and say, this is terrible. I feel worse. My bloating is increased. My breast tenderness is increased. And the reason why is progesterone wakes up your estrogen receptors, so the sensitivity goes back up to normal. So let me explain this. It's just like a rock concert. Okay, initially you go to the rock concert and you go, this rock concert is very loud. And then after about half an hour, you go, hey, it's not so loud anymore. Okay, and then when you take the progesterone, all of a sudden the rock concert's loud again. Now, has the noise of the rock concert changed? No, your sensitivity has changed. And that's what's happening with these people. Okay, so the solution is to cut out all xenoestrogens. Do not deviate from the purple sheet. Wait 1 to 3 months until they wash out of the body. So if you put a lotion on your skin, typically, since it's oil soluble, it'll take 1 to 3 months to wash out of your body. Okay, then take the progesterone. So let me tell you about some people. I've been doing this for 12 years. I have 18,000 patients, and this lady calls me up, and she says, "This mascara is making me bloat." And I said, "You've got to be kidding me, No, mascara's only on your eyelashes. No. It's just, no, this is not making you bloat and breast tenderness. This is psychological." So, no, you don't understand. This is making me bloat. So I hang up and I think, crazy lady. And then 3 days later, a different lady, unrelated to the first, calls me up and said, "This mascara is making me bloat." And I went, really? Okay. 3 months later, a third different lady calls me up and said, "This mascara is making me bloat." Okay, so small amounts of chemicals such as mascara, okay, can act as an estrogen and make you sick. And this is kind of amazing. Okay, so please do not deviate from the purple sheet. Okay, I'll tell you another anecdotal story. I had a mother and daughter with PMS, okay, up in, I think, North or South Dakota. I can't remember which one it was. And the mother said, "I have PMS. What do?" I said, "Eliminate xenoestrogens, okay? Take some progesterone. In a couple of months, okay, if you're really good about your avoidance list, you won't even need the progesterone." So she does that, and guess what? No more PMS. She does not take our product anymore. She's just normal. Okay, and she goes, "Well, my daughter has PMS. What do?" I said, same thing. Cut out xenoestrogens, take some progesterone. In a couple of months, she won't even need progesterone anymore. So she does that with her daughter, and she calls me back and says, "It's not working. Your progesterone's not working." I said, "There's a xenoestrogen in your environment." She goes, "No, we use all the things from the health food store. It's all natural. It's all healthy. No, this is fine." I said, "No, this is xenoestrogen in your environment." So we go back and forth by email for 6 months. Still not working. Okay, finally she drills down on all her daughter's things that she's using on her skin. She finds out her daughter is using a deodorant with lemongrass oil. She cuts that out. All the bloating, breast tenderness, PMS goes away. She no longer uses our product anymore. She is just normal. Third anecdotal story. This one lady calls me up and goes, "Your stuff doesn't work. I'm having increased bloating, increased breast tenderness." So I take an hour, I go through all her things. I said, "I think it's your laundry detergent from the health food store." "No, this is a good laundry detergent from the health food store. It's an expensive laundry from the health store." "No, it's not my laundry detergent." A year later, she calls me up. "It's still not working." I said, "I think it's your laundry detergent." She goes, "No, this is a good laundry detergent. It's from the health food store." 2 years later, she calls me up. "It's still not working." Okay, I said, I think it's your laundry detergent." She goes, "No, this is a health food store laundry detergent. Of course, it's fine." 2.5 years later, she finally changes to the longitude that we recommend, okay, on the purple sheet. In about a month, all her bloating and breathlessness goes away. Okay, so please do not deviate from the purple sheet. Okay, so some of my prospective customers say, well, why don't you do testing? And what's the matter with you? You know, how can you do this? Well, I used to do saliva testing. I used to do hormone blood testing. But most of the time, the blood or saliva test is normal for the patient's age, the hormone test. After the age of 35, most cycles have 0 progesterone. This is normal for that patient. And so a lot of times the patient will call me, I have 0 progesterone. I said, how old are you? Well, she goes, I'm 35. I said, well, that's normal. The problem with the hormone test is it does not measure xenoestrogens. For instance, lavender creates man boobs, but the hormone test does not measure lavender. Okay, it only measures your own progesterone, estradiol, estrone. It does not measure lavender, but lavender mimics estrogen. Okay, in some cases, estradiol is elevated, but usually is easily traceable to certain foods, such as coffee or something that you're putting on the skin. So decaf or not, several cups a day of coffee elevate estradiol by 70%, according to a Brigham Young University study. So instead of measuring the hormones, I just ask the patient to stop the lotion and the food, and guess what? The estradiol becomes normal. Iodine is actually extremely important. Again, please follow the instructions on our purple sheet about iodine. Over 90% of Americans are iodine deficient, according to Brownstein, MD. And again, here's the chemical formula for iodine, T4. You can see that there's 4 iodines. Bromine and fluoride poisons the thyroid hormone. So bromine is found in commercial bakery goods. It's found in some sports drinks, fluorides in toothpaste, and in fluoridated water. And what happens, it's hypothetically thought that this bromine and fluoride replaces the iodine on T4 or T3. And then what happens is this thyroid hormone becomes useless and does not work. Taking iodine will push out bromine and fluoride. Okay, according to Brownstein, MD, and he's measured this. You can take a whole bunch of iodine and you can see your urinary excretion of bromine and fluoride go up. Iodine seems to make you less sensitive to xenoestrogen, so I don't quite understand what's going on there. Maybe iodine may force some conversion of estradiol to a more weaker estrone or estriol, according to one physician. Okay, but it seems like the patients I give iodine to, they get much better. So, for instance, I had one patient in the UK with a small fibroid the size of a baseball. She was on our program for 5 months. Nothing was happening. And then she went to the grocery store and found a small bottle of iodine on the shelf on clearance. She took that iodine and started pinning it on a 2-inch square on her arm. And within 3 weeks, her fibroid disappeared. So I go, really? That's interesting, you know? Turns out the UK, they're even more iodine deficient than in the United States. So I had another patient up in the UK. She had endometriosis. She had pain 9 out of 10, where pain is the pain of childbirth. Okay, she went on our program. After 5 months, she's got pain of 3 out of 10. She's pretty happy. Okay, I told her about the iodine. She started taking iodine. Within about 3 weeks, she had 0 pain out of 10. So this iodine cannot be disregarded, and you should be taking iodine according to the purple sheet in our booklet. Again, please take it with selenium. People who have selenium deficiencies and take iodine sometimes get into trouble. Okay, this is the overview.